On Monday, June 13th, the White House convened an organ summit to address the organ shortage crisis here in the United States. Too many Americans, approximately 100,000 people, are on the waitlist for kidney transplant, and 13 die each day. Recognizing this public health crisis, the White House brought together American Society of Nephrology representatives as well as other stakeholders to address the scientific, innovative, and policy solutions to this problem.
This is Ray Harris, the current president of the American Society of Nephrology.
I'm John Sedor. I'm chair of the Public Policy Board.
Thanks for being here today with us. Dr. Harris, Dr. Sedor, you just spent the day at the White House. Tell us about why you were there and what you were doing.
The White House had put together a meeting on innovations in both transplant and ESRD treatments, which was really very, very exciting. And they invited a wide range of individuals from industry, from societies, both ours and the NKF, also from the FDA. And we heard some wonderful talks and then had a very informative roundtable about what are the next steps for how to innovate in this space.
The ASN announced at the meeting that it was committing up to $7 million to begin funding for an X Prize for innovative dialysis technologies, kind of a kidney moonshot prize. And that actually, Michelle Josephson, the chair of the Transplant Advisory Group, announced it, and it was really the subject of the roundtable with members of the FDA, CMS, and some of the other scientific agencies there, talking about the best way to get this implemented and to move things forward. We also focused on the kidney diseases under-recognized, as research in kidney disease has been underinvested. And we asked the White House to help us raise awareness about the problem kidney disease is for patients across the country, and in fact worldwide.
But we do think this is a very positive step that the White House has identified kidney disease broadly as an issue which is very important for the country's health. And we're really delighted that they took the time and the energy and the effort to put together this conference. And we're hoping this is just the beginning of a larger initiative. I do have to say that the idea of the X Prize really resonated throughout the conference, and there was a lot of enthusiasm about that. And so we're really hopeful that this will move forward in a very positive way.
And can you tell us a little bit about what ASN anticipates this X Prize competition might bring about and the types of needs it seeks to address?
Well, we really are looking for innovative renal replacement therapies for our patients. And as I think our members know, innovation has been stagnant, particularly in renal replacement therapy and dialysis. And we're hoping that this will seed an effort to really accelerate what's going on in a number of labs around the country to improve the technology, not only the mechanical parts, but maybe the biological parts with cells and better ways to treat end-stage kidney disease.
And Dr. Harris, maybe you could address ASN's other commitment that was announced at the White House Summit today, our partnership with the VA.
Yes, we're very excited about this other commitment, which is also a prize, which is to develop innovative ways for patients to be able to self-monitor for patients who have chronic kidney disease or even end-stage kidney disease, to be able to self-monitor their status and lead to a general improvement in their health. And so this is a joint prize that will be developed by the ASN and the VA together.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.